Okay, when palpating the knee, you are looking for pain in the face, crepitus, obvious deformity, swelling, and a temperature change. So palpating her left knee, we're going to bring her up into knee flexion, and on the lateral side of the lower leg, you have your fibula, fibular head. On the medial side of the lower leg, you have your tibia, your tibial tuberosity right in the middle. You have your Gerdy's tubercle on the lateral side. On the medial side, you have your pezian serine, and then you have your lateral condyle of the tibia and the medial condyle of the tibia. Your femur, just above it, you have your medial epicondyle and your lateral epicondyle. And then on your patella, you have the base, which is superior, and the apex, which is inferior. Soft tissue, you have your patellar tendon just below your patella, and then your quadriceps tendon above it. You have your biceps femoris attaching to the fibular head, and then you have your IT-band, which comes and attaches to your pezian serine. I'm sorry, that's your Gerdy's tubercle. On the medial side, you have your semitendinosus wrapping around, attaching to your pezian serine, and then attaching to the posterior portion of the tibia, you have your semimembranosus. You also have your gastroc, which attaches to the posterior surface of the femoral condyles. And then you have your popliteus, a little key to the knee back there. You also have on the medial side of your patella, your medial synovial plica. And then you have your medial collateral ligament on the medial side, and you're keeping into a 4. You can feel their lateral collateral ligament on the outside. Going into special tests, starting with the ACL and the walk-in. This one you're testing for an endpoint or an abnormal endpoint. So you're just going to stabilize the femur with one hand, and with your other hand take the tibia with your thumb right over the tibial tuberosity. Try and have them relax as much as they can. Just relax. Relax. And you're just going to try to get them to relax. And then have them relax. You're pulling their tibia anteriorly, testing to see if the ACL gets there to stop it, which would be an endpoint. No endpoint or abnormal endpoint is a positive test for a ACL sprain, anterior cruciate ligament. Also for the ACL, bring them up into 90 degrees of knee flexion. Just slightly sit on their toes. The anterior drawer test, so you're going to grip on both sides of their tibial tuberosity and just on the back side. Have them relaxed, and then you're trying to anteriorly translate their tibia. You would go both knees, and you're looking for increased laxity compared to the other one, which would be a positive indication of an ACL sprain. Now is the slocum anterior drawer. So if you put them into external rotation, you're going to test the medial side, again, just under the backside of their hamstrings and thumbs by the tibial tuberosity. You're trying to pull the tibia anterior, translate it, and that's testing for anterior medial rotary instability of the joint capsule. And if you put them in the internal rotation, you're now testing the same thing on the lateral side. Pull the tibia anteriorly again, testing for anterior lateral rotary instability. Also for the ACL, you have the pivot shift. So you're going to take their heel or calcaneus in your hand, internally rotate them, and then bring them into passive flexion as you're applying a valgus force. And when you come down at the end, you're feeling for a clunk or a shift of the tibia, meaning the ACL is not working correctly to decelerate the tibia as it comes back out. So a positive indication, clunk, shift for an ACL sprain. Next we're going to do PCL. So we're going to go back up, same position as the anterior drawer, but this time instead of pointing anteriorly, you're going to push the tibia posterior test both knees looking for laxity. Increased laxity would be a positive sign for a posterior cruciate ligament sprain. Also for the PCL, bring the other knee up, make sure your heels are level, and you're looking at their tibial tuberosities, looking to see if one posterior sags, and this is called the posterior sag test. This positive would be increased posterior sag compared to the unaffected side, which would be positive for a PCL sprain. Also, with the stool, bring them up. This is Godfrey's 1990. Again, looking for the tibial tuberosities for one of them to sag, which would be a positive indication of a PCL sprain. Flip them over for the dial test. This one, have them relax. And then you're going to bring them to 90 degrees of knee flexion, externally rotate. And you're looking for at least 10 degrees more of external rotation compared to the opposite side, which would be a positive indication for a PCL sprain. And then same test, let them relax in your legs. Bring them to 45, exteriorly rotate, and an increase in rotation by 10 degrees compared to the other side would be a positive indication of posterior lateral rotary instability. Flip them over again. So now we're going to test the medial collateral ligament. So for this one, valgus stress test, you're going to have them relax, and at 0 degrees, you're going to place a valgus force on the knee, and then again between 20 to 30 of a valgus force. You're looking for, again, increased laxity compared to the other side, which would be a positive implication of an MCL sprain. And then opposite would be the Barrett's test. So you can have them scoot to the edge of the table if you want. Bring the leg out, let them relax. Again, at 0 degrees, you were applying a Barrett's stress, looking for increased laxity, and then again at 20 to 30 degrees of knee flexion. Again, looking to see if there's increased laxity compared to the other side. That would be a positive test. If there's increased laxity, positive for LCL sprain. Next, we'll do Nobles. So we're gonna compress the IT band either just above Brody's tubercle, and then you're going to take them into passive flexion and extension. Positive sign of that would be pain right where you're compressing with your thumb, which would indicate IT band pain syndrome. And then we'll do readiness test. So have them come off the table, just enough away from the table. And again, you're going to find the same place just above Grady's tubercle over the IT band. Have them squat, and then come back up. And this one would again be pain over the spot where I'm compressing, which would indicate IT band pain syndrome. So this one we're testing for meniscus thessalines. So you're gonna have them, whichever leg is injured, help them balance. So give them something to balance on, and then you're going to flex slightly, about 5 degrees, and then you're going to walk with them as they externally internally rotate. And then again, let them rest, do it again. At 20 degrees of flexion, a little bit deeper, externally walk with them so they can balance, and internally. And for both of those tests, you're looking for them to feel popping, grinding, or pain right along that joint line as they do it, and that would be a positive indication of a meniscal tear. Next, we'll do McMurray's. So have them relax. Bring them up slightly. So you're looking to find their joint line, and then grab their heel. This one, you're going to do it on 3 passes. So you're going to internally, externally rotate as you bring them into flexion. So the first one, you're just going to go straight up into flexion while you're externally and internally rotating them. Good. The next pass, you're going to apply a valgus force to the knee while still externally and internally rotating. The last one, bring them into varus and externally and internally rotate them. That one, you're looking to feel popping or cracking along the joint line while you're holding them and taking them in and out, or pain. They will feel pain along the joint line. That would be positive for a minuscule tear. The next one we'll do will be for the patella. So this one is lateral compression test. So you're going to compress the skin around from superior and inferior to the knees, press it towards the patella, and then you're going to place one finger and compress the middle after you've compressed. And that one, a positive sign would be it's slow as it comes back up, which would indicate strong nerve fusion in the area. Next one would be apprehensions test. So you're going to put your index fingers on the medial side and your thumbs on the lateral side, and you're just gonna kind of play with their patella, and then bring them not sublux, that would be bad. Going to bring their patella laterally, and if they have fear or have the sensation that the patella is going to come out, or they feel like it's happened before, that would be a positive sign for possible patella subluxation. Next one would be Clark's sign. And this one's testing for chondromalacia or patellofemoral pain syndrome. So with the web of your hand, you're going to compress their quadricep tendon. The other hand, you're going to compress the patella against their femur and then ask them to contract their quad. And this one, pain or feel popping or cracking would be a positive sign of possible chondromalacia or patellofemoral pain syndrome. Next one would be for the medial synovial plica. So first one we're going to do, you're going to place your two fingers right on the medial synovial plica and ask them to, this is a stutter test, ask them to extend their knee and then flex it back down. And this one, you're feeling for popping, cracking, grinding. No, false, that's not what you're feeling for. You're feeling for a smooth motion as they come up and down. So if they go up and they kind of quiver a little bit, or you can feel it quiver, it would be a positive indication of inflammation of the medial synovial plica. You go back down. Same thing, still test. This is Houston's test. Place two fingers over the medial synovial plica and passively put them into flexion and extension, feeling for clicking over that medial synovial plica and pain as you put them into flexion and extension, which would indicate inflammation of the medial synovial plica. Last one is Wilson's test. So bring them to the edge again and then have them internally rotate the affected leg, ankle, have them extend, and then go back down. And if they feel pain as they're extending, ask them to externally rotate and see if they can continue the motion. And if their pain is relieved with external rotation, it would be a positive sign for an osteochondral defect on the medial side. And then we'll move on to manual muscle testing. So when you're manual muscle testing, it's graded from 5 to 0. 5 being they can go against your full resistance against gravity. 4 being against minimal resistance from you as well as gravity. 3 would be just against gravity. And then 2 would be against your resistance with gravity. 1 being there's a contraction but no movement of the muscle. And then a 0, no contraction when they try to contract that muscle. So to start, we'll start with the quadriceps. So you're gonna brace just above their knee, come to the side so you don't get kicked in the face, so that'd be bad. Place one hand just above their ankle and then ask them to push out. And that would be a concentric manual muscle test of the quadriceps. Isometric, have them come out, say don't let me push you down. And then eccentric, resist me but control me as I go, let you back down. So then to test the hamstrings, now we're going to do gastroc while you're here. Do the gastroc, bring them out, ask them, we'll do isometrics, point your toes, don't let me push you back up, and that would be a manual muscle test for the gastrocnemius. Have them flip over. And now we're going to do the hamstrings. So if you just want to do just hamstring in general, all three muscles, just have their foot neutral. Brace their leg, and it's for isometric. Don't let me pull you down. If you're going to test the biceps femoris, put them into external rotation. Again, don't let me pull you down. And then for semi-membranosus and semi-tendinosis, internally rotate them. So don't let me pull you down. That would be manual muscle testing for the hamstrings and all three. Then have them, now we'll have them stay here. So now we're going to test active and passive range of motion of the knee. So you have them come to the edge of the table. You can have their legs hang off. Don't fall off though. So your axis is going to be right at where, go back out here, right where the joint line is. And then you're going to ask if you can palpate their greater trochanter. So find that sucker and line up the stationary arm with it. So then now have them relax. And then you're going to have them flex as far as they can go, lining up the moving head with the lateral malleolus. You can relax so you don't cramp. Then you're going to read, and she has 132 degrees of knee flexion. Have them relax. Again, line it up with the joint line, your axis. And again, find the greater trochanter on the femur. Line up your stationary arm, and then have them extend as far as they can. And then line up your moving arm again with the lateral malleolus. Relax. And she has 5 degrees of extension, positive. Flip over. So this one we're going to find the Q angle. So we'll have her palpate her anterior superior iliac spine, lining up the stationary arm, and lining up the axis with the middle of her patella. And this one, make sure she's relaxed in a neutral position. And then the moving arm is going to be lined up with the tibial tuberosity, which you can mark it so it helps you. And then you are going to, you're not lined up, there you go. Then you're going to read it, and she has a Q angle of about 10. So key is on that one to make sure that she's not laterally or externally rotated with her toes or internally rotated, because that will skew either to be larger or positive or negative. She ends up right about 10.